demyelination disease and other peripheral autonomic nervous system, autoimmune and congenital genetical, and just like demyelination and substantial ratio for dopamine production. Then you know about sarcoids. I will tell you about the role of sarcoids in these central nervous system disease, because acetylcholine is your neurotransmitter and myasthenia gravis. Dopamine is your sarcoid in Parkinsonism. The substantial ratio, if you know about the origin of organ, I have already asked about the an epileptic, about cerebrum role. I study both points, both centers, and epileptic epileptic lecture formation center and reticular. These 2 points in epileptic, and about temporal occiput and parietal and frontal cerebrum during an anti-epileptic homeopathic drugs. These sarcoids and myasthenia gravis, you have to know about the function of acetylcholine. You have to know about function of 5-deoxytryptamine, which is in serotonin form. You know about the brain 8 neurotransmitters. These 8 neurotransmitters runs your whole system. You know about GABA, you know about, and in epileptic case we already study GABA and glutamic acid, glutamate, excitatory and inhibitory receptors. And that is why a sarcoid is, and structure cerebrum potency is also cerebellum potency. So cerebrum, from cerebrum, as you know about, we have thalamus potency, we have hypothalamus, we have cerebrum, we have number of sarcoids. Either the secretion of either these neurotransmitters and body organs used in central nervous system disease, central nervous system disease. That is why you have to remove the role of sarcoids and the nervous system disease. Besides these, you have to have a little bit knowledge about bowel nosodes. I have about more than 10 bowel nosodes. I have a potential of these bowel nosodes, and these work wonderful as a drainer. You know about the classic nosode function, its role in genetic disease, its role in autoimmune disease. They work very wonderful. Previously the 5 miasms, but nowadays we have more than 10 miasms, anti-miasmatic drugs about these 10 miasms. But if you know about the bowel nosodes, if you know about the Morgan series, I've already discussed about bowel nosode in my previous lecture, that God provides us about 300 types bacteria in our guts. It is total 30 trillion in numbers. It synthesizes about 3,000 enzymes for us. This is our second brain. Beside this brain, your first brain is nothing, because these neurotransmitters, even these bacteria synthesize few neurotransmitters for you. If you know the biochemistry of, because these all bowel nosodes work on biochemistry level. If you know about the cycles, carbohydrate cycle, protein, if you know about the fat metabolism, protein metabolism, and carbohydrate metabolism, then can you easily understand the bowel nosode function, mechanism of bowel nosodes. If you know about Margan is psychotic, antipsychotic, but its effect is, if you study the about 100 pages of sulfur biochemistry, its effect on biochemistry, it's totally correlate with Margan and sulfur. And if you know about the lycopodium, which you know about role in mitochondria metabolism, lycopodium role and mitochondrial and enzymatic effects and role. Similar, Margan Gretner is just like work as a lycopodium, and that is why in central nervous system, congenital cases, encephalitic miasm, you know about, and we have no substantial nigra and PK. Function of substantial nigra, dopamine synthesis finish, reduce. That is cephalitic miasm. Gretner is Margan of three. I know about Bacillus Margan, Margan Gretner, and Margan fever. Similar, the Gretner is, and if you other the role of bowel nerve and central nervous system is very important. And all these number of nervous system disease, I will use number of times in every case a bowel nerve for brain function, for metabolism function. Besides these, for other drainers, just like gemotherapy and nervous system, particularly you know about those gemotherapy. The gemotherapy means the drugs synthesized from buds, which is very effective because the active ingredient peak active ingredient, the concentration of in buds, and plant buds. These are gemotherapy. And you have little know about litho, you know organometallic, and litho usually available in injectable form, and gemo available in drops form. If you know these are all medicines and plant medicine, you know numerous plants medicine, you have Solanaceae groups. If you know about the function of sonal mechanism of Solanaceae group, its central effect on central nervous system and autonomic nervous system. If you know the stramonium has seen the thora plants is active ingredient alkaloid is, you know, stramonium. Hyoscyamus nigra is active ingredient is hyoscine, and Atropa belladonna is active ingredient is atropine. You know about these and its effects on our central nervous and autonomic nervous system. You know about these Solanaceae family effect as the and sympathetic and parasympathetic system. You know about our urea and phosphor salt use and urea form for our plant growth. These, if you know about these Solanaceae family, you know about Cactaceae family, Annullanium, and you know about Leguminary family, and you know about other group families just like Cicuta, Conium, Naxomica. These, if you know about these medicine, it's work wonderful on central nervous system. If you know about the mechanism of these alkaloid and glycoside, it's work wonderful. And animal case, you know about, we are closely related to animals. If you study the different groups of animal categories, spider groups, the snake remedies, birds, mammals, other, then you easily know about The spider poisons, its effect on nervous system, just like and demyelinated cases, Naja, from Cobra we have Naja and demyelination and Parkinson cases. And you know about other snake remedies, and you know about tarantula, you know, and usually if you study about black spider and arania, the arania category, arania diadema and arania expola, then we will be, these spider remedies totally act on peripheral, spinal, central nervous system, and autonomic nervous system. Their work is very wonderful work. Now we will continues these classes, this session of central nervous system disease, multiple sclerosis, Parkinsonism medicines, MND, motor neuron diseases. We have a number of other neuromuscular disease. We have studied all these 8 group of medicines for this disease. Thanks. Allah Hafiz.